In this channel, we always watch over your health and good practices, so today we want you to learn how to practice CPR correctly or what to do in case of emergencies. Call for emergency help. The first step when you encounter a person who has collapsed and is unresponsive is to call emergency medical services. This will ensure that professional help arrives as quickly as possible. Check for responsiveness. Once you've called for help, you need to check if the person is responsive. You can do this by gently shaking their shoulders and shouting, "Are you okay?" If there is no response, it is time to move on to the next step. Open the airway. To open the person's airway, tilt their head back by gently pushing their forehead and lifting their chin. This will help to ensure that their airway is clear and unobstructed. Check for breathing. Once the airway is open, you need to check for any signs of breathing. Look, listen, and feel for any movement in the chest, any sounds of breathing, or any breaths on your cheek. Do this for no more than 10 seconds. If the person is not breathing, it is time to start CPR. Give chest compressions. To perform chest compressions, place the heel of one hand on the center of the person's chest, between the nipples, and the other hand on top of the first. Lock your elbows and use your upper body weight to push down on the chest, compressing it at least 2 inches 5 centimeters, but no more than 2.4 inches 6 centimeters. Do this at a rate of 100 to 120 compressions per minute. Count aloud to help you keep the rhythm. Give rescue breaths. After 30 compressions, give 2 rescue breaths. Pinch the person's nose shut and tilt their head back. Place your mouth over their mouth, making sure to create a seal, and blow until you see their chest rise. Each breath should take about 1 second. Repeat chest compressions and rescue breaths. Continue performing cycles of 30 chest compressions followed by 2 rescue breaths until emergency medical services arrive or until the person starts breathing on their own. It's important to maintain a steady rhythm and to try to avoid interruptions in compressions or breaths. In addition to the steps outlined above, there are some other important things to keep in mind when performing CPR. Don't stop until help arrives. It's important to continue performing CPR until emergency medical services arrive or until the person starts breathing on their own. Don't stop unless you are physically unable to continue, or if the person starts breathing again. Be aware of potential risks. CPR can be physically demanding, and there is a risk of injury to the person performing it. In addition, there is a small risk of infection or disease transmission, especially if the person being resuscitated has a contagious illness. Take precautions such as wearing gloves or using a face mask if available. Be aware of special situations. There are some situations where CPR may need to be modified or performed differently. For example, if the person is pregnant or has a medical device such as a pacemaker, special care may need to be taken. Additionally, if the person is a child or an infant, different techniques may be used. Get trained in CPR. Finally, it's important to get trained in CPR if you haven't already. There are numerous courses available, including in-person and online options, that can teach you how to perform CPR correctly and effectively. Knowing how to perform CPR could mean the difference between life and death in an emergency situation. If you're interested in getting trained in CPR, there are several options available. American Red Cross. The American Red Cross offers CPR courses both in person and online. Their courses cover adult, child, and infant CPR, as well as other life-saving skills such as AED use and first aid. American Heart Association. The American Heart Association also offers CPR courses for both healthcare providers and the general public. Their courses cover adult, child, and infant CPR, as well as other topics such as choking and AED use. Local hospitals and healthcare providers. Many local hospitals and healthcare providers also offer CPR courses. These courses may be geared towards healthcare professionals or the general public, and can be a great way to learn CPR in a hands-on setting. Online courses. There are also several online courses available that teach CPR. While these courses may not offer hands-on practice, they can be a convenient and affordable option. Another important aspect of CPR is understanding the difference between cardiac arrest and a heart attack. While these terms are often used interchangeably, they refer to different conditions. Cardiac arrest occurs when the heart suddenly stops beating, which can be caused by a variety of factors including heart disease, electrocution, drowning, or trauma. When someone experiences cardiac arrest, their heart may go into ventricular fibrillation, which is a type of irregular heartbeat that requires immediate treatment with defibrillation. On the other hand, a heart attack occurs when there is a blockage in one of the arteries that supply blood to the heart muscle. This can cause damage to the heart muscle, but the heart may still be beating. Symptoms of a heart attack may include chest pain, shortness of breath, nausea, and lightheadedness. It's important to understand the difference between these two conditions, as the treatment for each is different. CPR is typically used for cardiac arrest, while a heart attack may require medications or procedures to remove the blockage. In summary, knowing how to perform CPR correctly can be a life-saving skill in an emergency. By following the steps outlined above and getting trained in CPR, you can be prepared to help someone in need. Remember to stay calm, call for emergency medical services, and continue performing CPR until help arrives or the person starts breathing on their own. It's also important to note that CPR is not always successful. Even with the best efforts and techniques, there is still a risk that the person may not survive. However, performing CPR can still be valuable in providing the person with the best chance for survival and increasing the likelihood of a positive outcome. In addition to CPR, there are several other ways to help prevent cardiac arrest and improve overall heart health, including maintaining a healthy diet. Eating a diet rich in fruits, vegetables, lean protein, and whole grains can help reduce the risk of heart disease and other conditions that can lead to cardiac arrest. Staying physically active, regular exercise can help improve heart health and reduce the risk of cardiac arrest. Avoiding smoking. Smoking is a major risk factor for heart disease and can increase the risk of cardiac arrest. Managing stress. Stress can contribute to heart disease and other health problems, so it's important to find healthy ways to manage stress, such as through meditation, yoga, or other relaxation techniques. It's important to note that there are different techniques for performing CPR on adults, children, and infants. In general, the steps for CPR are the same for all age groups, but there may be some differences in the amount of pressure applied and the use of special equipment such as pediatric pads for an AED. When performing CPR on a child, it's important to use the correct compression depth and rate. For children ages 1 to 8, the compression depth should be about 2 inches, and the compression rate should be 100 to 120 compressions per minute. The technique for performing rescue breaths may also be slightly different for children. For infants under 1 year old, the compression depth should be about 1.5 inches, and the compression rate should be 100 to 120 compressions per minute. The technique for performing rescue breaths is also different for infants, with a smaller amount of air being delivered with each breath. If you're ever in a situation where you need to perform CPR on a child or infant, it's important to follow the appropriate technique for their age group. You can learn more about CPR for children and infants through a CPR training course or by consulting with a healthcare professional. In conclusion, knowing how to perform CPR can be a valuable skill that can help save a life in an emergency situation. By following the correct steps and staying up to date on your skills, you can be prepared to help someone in need. Remember that you should always call a specialist, but you can make a difference. Help us to continue growing. Subscribe.